Dr. Ilan Linder, who is also from Israel. He's reporting on the findings of a pediatric epilepsy program in Israel. Dr. Ilan Linder studied medicine at Ben-Gurion University in Beersheba, graduating in 1998. His postdoctoral education included a residency and internship in pediatrics and later in pediatric neurology and child development at Edith Wolfstein Medical Center in Holon, Israel, at Professor Tahlia Saji's pediatric neurology unit. Currently, he heads the pediatric epilepsy clinic. His hospital work consists of consultations and specialized clinics such as catastrophic epilepsies and the metabolic genetic neurology clinic. He teaches and guides medical students and pediatric interns and medical nurses in the field of epilepsy. He also practices pediatrics and pediatric neurology in the community. Dr. Linder's first encounter in the field of medical cannabis first encountered the field of medical cannabis during a multi-center trial treating pediatric epilepsy patients with cannabinoid oil extracts and vaporized cannabis. He leads the pediatric neurology branch. Dr. Linder recently spoke at the Israeli League Against Epilepsy annual meeting in January 2016, sharing his experiences in treating pediatric epilepsy patients with vaporized cannabis. He is a member of the Pediatric Neurologist Committee in the Ministry of Health, structuring guidelines for the use of medical cannabis in pediatric epileptic patients with oil extract and vaporized cannabis. Ladies and gentlemen, please welcome Dr. Ilan Linder.
Good morning, everyone. My name is Ilan Linder. I'm a pediatric neurologist from Holon, Israel. First, I would like to thank the UIC, Lucy, for inviting me here to Australia, and also Troy and Michelle, of course, for assisting me all the way. Thanks. But especially, I would like to thank all of you, ladies and gentlemen, for making the effort and coming here this morning. Sorry. I will talk to you about our observational study that we have been conducting for the past 2 years, evaluating the effect medical cannabis has on children with intractable epilepsy. I will talk about enriched CBD oil mixture with a THC-CBD 1:20 ratio, but also about our experience treating vaporized medical cannabis. I tried to liven up my the facts and figures a little bit with clinical case reports, which I hope will be interesting, and I will conclude our with our learned experience and thoughts for future times. My personal biography, my medical biography that is, begins at 1998 when I graduated medical school, and since then I'm effectively working in Edith Wolfstein Medical Center at Holon, at the pediatric neurological unit headed by Professor Tahlia. I'm heading the pediatric epilepsy service there. I'm also the proud father of 3. My eldest son is 18, and I have 2 daughters who are 15 and 10. Israel and Australia have similarities. Mainly, I think, is the fact that both are immigrant nations. I think this slide demonstrates it quite well. If there were no writings on the plane and the ship below, I think hardly anyone could tell the differences between the hope that's expressed on the faces. I hope over at the back you can see it as well. Personally, my family originated from Poland. My surname Linder has no meaning in Polish, but in German it has 2 meanings. The first being, and I won't tackle the botanists here, it's the linden tree you see on the right. And, but the second, which I was happy to embrace later on in my life, that Linder or linden means to heal, possibly coming from the bark of the linden tree. So I hope, like many other speakers before me, that you have heard before me, that I will also give my share in the healing of all our patients. If one observes epileptic patients, one can soon find out that about 30% of them fit into the category of intractable epilepsy or drug-resistant epilepsy, meaning that it is a failure to stop all seizures, all daily seizures, after an adequate trial of at least 2 antiepileptic drugs. The efficacy of current medication in these cases is limited. The options are few and varying between the ketogenic diet, the vagal nerve stimulation, the VNS, or surgery when applicable. We have joined forces, so to speak, in 3 medical centers mentioned before in the Tel Aviv area, which is not something which is easy to do with many physicians. Before you is our first the publication of our first year, describing 76 patients treated with medical cannabis. It was published in January in Seizure, describing 76 of them. Same January, we also presented in our annual League Against Epilepsy our current numbers in the treating with medical cannabis oil and vaporization. Let me first emphasize once again that this is in effect an observational study. Patients were in our tertiary epilepsy referral centers for 12 months prior to being enlisted, prior to being included in the study. We used, like mentioned, an enriched CBD 1:20 ratio. Controlling was done by 2 independent labs. One is a university lab, and the other a GMP-approved lab. Collection of data was done at visits or phone visits. To be included, one to have, of course, refractory epilepsy with at least 5 to 7 antiepileptic drugs being used before, or ketogenic diet, or VNS, or surgery. Patients were treated for consecutive 3 months before being actually included. The age range, we aimed for an age range of 1 to 18. The dash sign is because actually in Israel we don't have such a good transition epilepsy units for the elderly above 18. So many of our patients, actually, we do see them later on when they're in their 20s, and even after that. The exclusion criteria, right in front of you, are severe behavioral disorder, if there was any significant family history of psychiatric background, or congestive heart failure. We tried to refrain as much as we could from dosage adjustments in the first part of the trial, that is, at least. We had 130 patients with refractory epilepsy, and as you can see, it is quite clear that many of them have used many drugs before being enlisted in the study. The age range, in actual fact, was between 1 year and 32 years, but you see that the vast majority of our study were under 15 years of age. Another figure, which is quite impressive, is the fact that above 90% of our study population were intellectually disabled. This is quite clear when one looks at the etiology related, making epileptic encephalopathy the far largest. Epileptic encephalopathy, as the definition by the International League Against Epilepsy, the ILA, is a heterogeneous group of epilepsy syndromes associated with severe cognitive and behavioral disturbances. These disorders vary in their age of onset, development, outcome, etiologies, neuropsychological deficits, EEG patterns, seizure types, and prognosis. but all may have a significant impact on neurological development. Again, you see the etiologies, and if we can further delineate them, then you see that the acquired group consisted of cytomegalovirus, CMV, herpes simplex virus, FARS, which we'll elaborate in a few minutes. The genetic epileptic encephalopathies consisted of Dravet syndrome, the CDKL5, tuberous sclerosis, for instance. Also of note are the brain malformations such as agenesis of corpus callosum or cortical dysplasia, the hypoxic ischemic encephalopathy consisting about a fifth of our patients, but you see that there are quite a few that we don't have any etiologies for. This is a good time to present to you a few of our patients. The first being Oria in the middle. They live in the south of Israel, in Eilat. This is Oria, is a 12-year-old girl. She has myoclonic encephalopathic epilepsy. She's currently being treated with 4 antiepileptic drugs and VNS. In the past times, she used to be treated with ketogenic diet, and all in all, she had at least 13 antiepileptic medications. Medical cannabis improved her continuous myoclonus. She had these jerks in her fingers all the time, and in her upper extremities and upper trunk. This myoclonus responded in the past to valproic acid, which gave us the notion that it must have been of epileptic origin. It is quite difficult to perform recurrent EEGs to patients in that condition, so sometimes we do rely on the clinical outcome. When the parents were confronted, they actually said that this was a major improvement in their quality of life. In past times, she used to have these continuous nighttime unease due to this myoclonus, which stopped completely after the use of medical oil. This is Yuval, this pleasant young fellow. He's 11 years old. At 7 years, he had FIRES, which I said earlier. FIRES is the febrile infection-related epilepsy syndrome, which was the presentation. He had super refractory status epilepticus, meaning that he was seizing all the time. He was hospitalized at the pediatric intensive care unit for about 3 weeks. Pursuing with intractable epilepsy, which left him with severe cognitive deterioration. He was 7 years old, and he actually functioned like 3.5 or 4 years old after this hospitalization. After medical cannabis oil initiation, he had the decreased number of antiepileptic drugs, and substantially he lowered his seizure burden, the seizure number, milder seizures, shorter seizure, and a very impressive cognitive improvement. Tahlia is one of the youngest, I think, if not the youngest of our patients. She's now 16 months old. She was presented at 2 months with epileptic encephalopathy. Later on, we discovered through exome sequencing that this is due to a genetic cause. She has a unique de novo mutation in the eukaryotic elongation factor 1A2. There are only 13 other known people with that mutation throughout the world, and she's the youngest of them all, and by far she has the worst presentation and ongoing epilepsy. The other people with this kind of mutation, with similar mutations, are doing less worse than her. Medical cannabis, which was really, the parents really pushed us into giving her medical cannabis, and they were right. Improved her myoclonic seizures and general alertness. Of course, she still has seizures, but the effect it had on her everyday life and her family everyday life was really astonishing. So, taking us back to the results of our study, the CBD dose range was between 5 to 30 milligrams per kilogram per day. The seizure frequency reduction, you can see that about 32% of our study population had a 50% and more seizure reduction. Relating to adverse effects, actually we don't have results that differ from those that were presented before me. Somnolence, decreased appetite, aggressiveness, fatigue, increased appetite also by few, restlessness. There were no systematic allergies. The dropout rate was about a third of the whole of the study, and this was due either to aggravation of seizures or to no effect whatsoever, or to some adverse effects that were evident. It is very important for me to stress out some important adverse effects that we did encounter. Much has been said about cannabis being safe. I have these two slides will, I think, enlighten this issue in a little different way. T is a 23-year-old female with Dravet syndrome. At initiation of medical cannabis, she was treated with 2 antiepileptic medications, one of them a benzodiazepine. Initiation of the cannabis oil caused severe and immediate seizures of new semiology to extent that we had to stop the medical cannabis, and immediately she stopped seizing the way she did. The second patient has an Lennox-Gastaut. You see he's also one of the senior patients. He's 21 years old. He has intractable epilepsy with cognitive impairment and autism. He's been on VNS for a couple of years, ketogenic diet in the past. He has still VNS and 3 antiepileptic medications and medical cannabis oil. Initially, he had quite an improvement with the medical cannabis, with the seizure burden and with his alertness. He even started playing the guitar, something which his parents were really impressed by. But then after he received the pure CBD, he developed a catatonic state, meaning that he had this muscular rigidity and a stuporous state. We had to treat him with excess benzodiazepines in this case, and gradually, but quite quickly actually, over 2 weeks that was, gradually we stopped the medical cannabis, and he returned to himself. Positive phenomena, you've seen it before: increased alertness, improved behavioral attention, sleep quality improvement, decreased salivation, improved pronunciation, better motor skills, decreased headaches, and improved dystonia. This is Bao. He's quite an interesting fellow. He's 16 years old. He has epilepsy and autism. We don't know the etiology for his state. His mother is a herbalist, and she's actually heading the Israeli group of parents of this forum of treatment of medical cannabis. He has complex partial seizures, and he has, from time to time, he has these clusters that are lasting for days at a time, sometimes with secondary generalization. After medical cannabis initiation, he's been receiving the extract and vaporization. The seizure burden decreased in intensity and better recovery from long seizures. In his case, it was a real quality of life changer. He does not miss school anymore. There is no stuttering that used to be in the past after these cluster seizures. He has improved handwriting, and most of all important, this is a 16-year-old. He used to sleep at his parents' bedroom, And by his own initiative, he just transferred away from his parents' bedroom to his own, and he's persevering for about half a year now. This is an example of his handwriting. On the left, you see it's in Hebrew. You see his handwriting before cannabis initiation, and on the right, you see it's a special notebook again, but you see that the handwriting improved and the letters are quite clear. And he wrote especially for all of you in English, "My name is Ba, I live in Israel, I'm 16 years old." This is Yotam, family, a Jewish family from America. The father is heading the cow industry, the kibbutz where they live, and the mother is a healer. And you see him in the middle. He's a very energetic fellow. He's 24 years old with Dravet syndrome. Currently, he's being treated with 2 antiepileptic medications. And after medical cannabis initiation, the vaporization oil and the oil extract, he absolutely has better seizure control and better quality of life for him and his family. I will say a few words about the second study that we conducted, a study within a study. And again, this was mainly because of parental, let's say, pressure or initiation, and we tried to at least to harness a little bit the treatment of the vaporization for medical reasons. This is a preliminary description of these pediatric patients being treated with vaporization. It is either the stationary vaporizers or the mobile devices, which you're all familiar with, and the examples are set here outside. Again, it's between our 3 medical centers. All in all, we had 24 patients that were being treated with vaporization. These are 24 patients out of the 130 to begin with. The inclusion criteria to be treated with vaporization was no response to medical cannabis oil extract target dose, being initially it was 10 milligrams per kilogram. Later on, we raised it as we went along to 15 milligrams per kilogram today, or 300 all in all milligrams daily. Either that or tolerance at medical cannabis oil target dose, cluster seizures, exceptionally intense seizure burden compared to baseline, or low compliance to medical cannabis oil extract, meaning the patients were not able to swallow these oil drops. The exclusion criteria: a respiratory disease. The vaporizers cause many times an irritative cough, which lasts for hours, and this was an exclusion criteria. Hypersensitivity reaction to the oil, which, like I previously mentioned, we hadn't encountered any allergic reactions. A cardiovascular disease, family history of mental illness, and of special considerations here were any kind of drug interactions listed below. We had 24 patients, which is about 1/5 of our primary cohort. There were 16 males and 8 females. Most were above 10 years old. These were the seniors of our population. And you see here the age range between 3 years and 32 years, with an average age of nearly of 12 and a half years, a median of 13. Contradictory to our primary cohort, you see here that there are, the intellectual disability ratio is it's lower. There are more alert kids, perhaps because of the cooperation needed. 23 patients were treated simultaneously with the oil extract. I know I said this was a preliminary requisite, but 2 patients later on stopped being on medical cannabis oil. The average treatment time was 13 months, like I said, and the total daily dose was about nearing 350 milligrams daily. You have the range there, you have 2 ranges. That is because one of the patients was extremely obese, so excluding him, you see a different range in the lower brackets. The average daily CBD dosage was 30 milligrams per kilogram today, within the range that we really wanted. I hope this is clear enough. You can see the age distribution with a large proportion being above 10 years of age. The response to vaporization, there were about 2 that responded tremendously well. That's in the bluish upper corner. At the lower side, the 5 are those who responded to short clusters. A mild response was experienced by 8. Low compliance were 2, as I mentioned before, and no responders were 7. By etiology, the response by etiology, you can see that there is some kind of effect to the genetic epileptic encephalopathies, with, at least in our small cohort, no effect whatsoever to those patients suffering from congenital brain malformations. I will begin with the conclusions about the vaporization and then continue to the whole of our study. Vaporization appears to be a promising and effective method of delivering medical cannabis oil for the treatment of intractable epilepsy in the pediatric population, especially the treatment of cluster seizures and, to a certain extent, epileptic encephalopathies. Vaporization appears to be unhelpful in congenital brain malformations. Shortening of cluster seizures and seizure intensity are considered, and especially by the patient families, a quality of life changer, a major quality of life changer. There is need for standardization of the vaporization devices and delivery methods and substances to be delivered. For instance, we began with heating to 230 degrees, later on moving to 210, and the current heating is 190. This is to avoid the pyrolytic substances for future times and present, of course. Do we need to recommend using the mobile vaporizers or the stationary vaporizers? Which is better? And moving on to our main study conclusions, medical cannabis oil, medical cannabis in general, has a substantial effect on seizures, especially, it seems, on genetic epilepsies. Administration has to be delivered by a caring physician. I think the examples shown about the safety and about the adverse effects, the true life-threatening adverse effects that we sometimes encounter, not always, but sometimes, do necessitate a physician on board. The initial target dose is between 10 and 15, I would say, milligrams per kilograms per day. But as mentioned yesterday, there is individual dosing up titration. We really see some effect with 1 to 2 milligrams per day, and other times we see the effect only with high doses. We see better efficacy when given the medical cannabis oil 3 times a day, but in some instances we do give them twice a day, especially with children that go to special care centers, to kindergartens, where sometimes the people in charge are reluctant to give the medical cannabis oil, so it can be done. We do continue the antiepileptic drugs. We don't, even if we encounter a quick response due to the honeymoon period, we do not stop the antiepileptic medication because this could be harmful. We do that gradually over time, over the visits. I mentioned before 4 medications that we know that have drug interactions. There are probably more than that. Absolutely, there are more than that, and we need the collaboration and the data to support that. Concomitant ketogenic diet or steroid therapy, we have to use with caution if we want to initiate that during after the initiation of medical cannabis, or treating at both times because of the side effects, either hypoglycemia or hyperglycemia, due to either ketogenic diet initiation or after being given steroids, you encounter hyperglycemia. There are relatively few adverse events. They are not dose-related. And about the safety, I think I've said a couple of words. The positive effects were quite overwhelming. The increased alertness, the behavioral change, the better attention span, the better communication encountered. Then again, a word of caution. We need to be especially careful with patients with psychiatric background. That is, it doesn't mean we cannot treat them. A few of those patients that have been in our cohort did receive at some time or another, did receive some medication later on for behavior purposes, as a requisite of them participating in everyday activities. And we should also consider administration of cannabis oil and cannabis vaporization to patients with normal cognitive function. I think that the results about the adverse effects and the positive phenomena do call for that. Our study limitations, we didn't have a control group. Some dosage adjustment inconsistencies these are 3 medical centers. There are we were about 5 to 6 physicians that were treating these patients, and different approaches to the medical field and different experiences have and sometimes do affect those dosage inconsistencies. Our overall results are relying on parental impression. So when we say that there is an improvement in the seizure burden, we are actually in fact relying on what the parents tell us. Now, you have to know that these are parents, as many of you here know, these are parents that are on a daily basis are living those seizures, and for them to write down every seizure and every movement, it's impossible. So we have to think of some good device or tool to measure that. We cannot put these patients on video EEG all the time. There are some tools which are expensive, but we need to construct, I think, globally here once again, to construct some guidelines to how do we measure these seizures in a correct way. About the long-term effects, let me just quote Professor Meshulam, he gave the keynote lecture at the Israeli League Against Epilepsy last January. He said that the long-term effects of cannabinoids, especially THC, to the developing brain are a main point of concern due to lack of enough relevant data in the medical professional literature. Thank you. And I think this is something we should all bear in mind. Although we did not exceed initially the THC level of 1 milligrams, later on in the study with the elder ones, we did reach 1.3 and 1.5 milligrams daily dosage of THC. This is a true matter of concern. And just lately, excuse me for not remembering the author, just recently in the past month was an article about the maternal delivery through the placenta and through breast milk of THC affecting the fetus and the developing child. So this is a true matter of concern. Future requirements: we cannot avoid the randomized controlled trials. We need to have some more uniformity within us, uniformity of the medical cannabis oil that we're using. We need to have sometimes a better supply, better lab facilities, that we know, like with medication, if we want to treat it as medication, we have to examine it as a medication, being GMP approved. We need to know that the dose that we are giving is the exact dose. We need a proper seizure follow-up. We need to do regular blood examinations of the effect that the medical cannabis has on the liver function tests. We need a regular EEG follow-up, although it is difficult, like I described to you and you know very well. We need the EEG follow-up. This is extremely important. We need to learn about the drug interactions, and we need to conduct a cognitive assessment in the beginning of the trial, throughout the trial, and after the trials, to know exactly how do we have this effect. And we need to measure the quality of life in better tools, which is, again, it's extremely difficult to measure the quality of life with someone you cannot conversate to, but you do have the parental impression, which is important. It was stressed out before me, but I will put my word in it again. There is a need for the accompanying nurse, especially for parental guidance and support. I cannot underestimate how much this is important. This day and age, we have the social media. The patients consult us 24/7, and that's blessed. But there is no substitute for the personal touch, and there is no substitute for meeting the patient's families, and explaining once and again how to deliver the medical cannabis oil or the vaporization, and to correct things that need to be corrected, and to give the proper guidance. I thank you very much for listening. I had a glimpse of Australia here for just a couple of days, and I loved it very much. You have a beautiful country, and I really thank you for this invitation. Thank you very much.